So Heather, we've now gone over how to clean the cannula and how to change that, how to change the dressing. What about the ties?
Okay, so ties we will change only when we need to. So if they're looking really bad, they're caked with secretions, that would be the time to change them. Or if they're, broken or someone's cut them.
These look pretty nice. I
nice
can
ones.
remember that they had, they used to use
Twills.
twill tape. Remember that?
Right.
And
oh yes,
and just like strings around there.
Yeah,
like
a tie a knot. And,
yes.
Yeah, they had to be cut off at
Yes.
that time. Yes, absolutely. And they would cut into the neck.
Yeah.
You'd actually use trach dressings or 4x4s on the side of their neck, especially if they had a really thick neck.
Yeah.
They were awful. They really were. Yeah.
So if we do happen to see something like that, we should make sure that we get something that's a little bit more appropriate. Right?
Especially if it's a long-term trach. Yeah, absolutely. These are, I think, called Dales. There's a variety of different ones out there, but these are nice and soft. They have Velcro on them. They're easy to adjust, easy to remove and replace. They're just wonderful. Yeah.
Do you ever find that there's some, like if there is a lot of secretions and it gets wet in here, does that Velcro let go at all?
It's not too bad. Actually, it seems to
stay?
hold quite well. But what you'll find is if it gets super wet, then it starts to stretch.
Oh.
Just like anything else,
so
it
then
starts to stretch.
This whole thing can sort of...
Exactly. So it'd be a matter of readjusting. And that's part of the RT's job as well, is to make sure that this trach tie is on correctly. And the correct way to check is you should be able to only get 2 fingers underneath.
Okay.
If you can get your whole hand under there, it's too loose.
Okay.
Okay. If you can't get any fingers, it's too tight. So loosen it off.
Yeah.
But 2 fingers only is
so
what
that's
you should
part,
be able to do.
as a nurse, we should be checking that too.
Absolutely.
To make sure that we have the safety equipment at the bedside and that this is secure.
That's right. Yeah,
Okay.
so 2 fingers should give them enough flexibility, not cut into their neck, but it's also not going to allow the tracheostomy to be coughed out.
Okay.
Yeah. All right, so we'll change this one up. So we'll say this one looks kind of gross. It's really much safer if you have another person. You can do it by yourself, but it is much easier and safer, like I said, to have somebody else hold the tracheostomy tube while you're changing the trach ties.
I happen to have gloves on, I can assist you.
Absolutely. This is a clean procedure. There's nothing sterile about this. This would usually be done after we've finished putting dressing on, etc. So I'm going to put some gloves on just to protect myself here. I have a new tracheostomy tube holder. If I can get it open, we are laughing. Okay, so this one's just a little bit different. Okay, so what I'm going to do is I'm kind of going to guesstimate how wide their neck is.
This is just on the back of their neck, and then you can adjust this for the size.
You got it. You bet.
Okay.
Yeah.
So I'll just...
So we're going to get someone to hold the flange, and you don't have to press really hard.
Push it in.
Just enough so that it's secure.
Okay.
And I can start removing.
So is it better
the
to do
trach
this?
ties.
It's probably easier if the patient's sitting up, or does
It's
it matter?
sitting up, semi-Fowlers, something like that. I mean, you can do it when they are laying supine as well, but it is much easier if they're up a little bit. So this is the dirty one. We're just going to remove it and get rid of it. I could change my gloves at this point as well, especially if this was really, really gross looking. Okay, and we'll grab the new one. So we're just going to insert the one end in here. Okay, and secure it down. And I'm going to bring the other end around. And again, letting the patient know what you're doing. Okay, Jean-Luc, I'm just changing your ties here so you look marvelous for your family. Oh my goodness, I think I might have actually calculated that right. So again, Wendy, you can let go now.
So you check, make sure that...
Yeah, make sure these are down, and I'm going to check to make sure that it's 2 fingers only, and it is.
Okay.
If it wasn't, I could adjust the width,
Yeah.
how far around it's going, or I can just adjust this portion as well to give him more flexibility or to tighten it up.
Okay.
Either way.
Is this something that you have to chart, or is this...
I would chart it, absolutely. Then it lets the next RT or nurse know how often we have to change these ties. Because
Okay.
maybe you could put it in as part of their plan for the day for the next 12 hours. You know, we've been changing this every 4 hours. I know in 4 hours I'm going to have to change it again.
Yes.
Yeah.
Okay.